Hello, everyone. Welcome to the Visionary Leaders Podcast. My name is Aisha Harley, and I'm one of the founders, and we are absolutely thrilled to have you here with us live today, or hello if you're listening to the recording. Please join us every Monday at 10 a.m. Pacific time as we explore all things wellness, essential oils, and doTERRA. If you miss an episode, you can catch up anytime on YouTube, Apple Podcast, or Spotify, and stay connected by signing up for our newsletter and text reminders at hellovisionary.life. Today is our daily habits episode with a focus on castor oil packs, the why, the how, best practices for optimal results. Castor oil packs have been used for centuries to support detoxification, digestion, hormone balance, and overall well-being. But how do they actually work, and what's the best way to use them? In this episode, we're diving deep into this powerful, time-tested self-care ritual and breaking down everything you need to know, including the science behind castor oil packs and why they're so effective, step-by-step guidance for effortless application, customization and pro tips to fit your unique wellness needs, the best materials and methods to maximize results. So if you're looking for an easy yet profound way to support your body naturally, this is it. Tune in and learn how to integrate the simple healing habits into your daily routine. And we are thrilled to have Blue Diamond leader Erin Fugate back with us on this call. So Erin, I'm going to pass it on over to you.
Thanks, Aisha. Hi, everybody. Just a raise of hands or a little heart who uses and loves castor oil. Whoop, 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 whoop. Put in the chat if you're not actually familiar with castor oil. And we're going to dive into all the wonderful ways to use it. So I have my bottle. I like the organic Heritage Store in a glass bottle. Yep, Dr. Mika has that too. So I get this, and then I have a friend who makes cool wraps. Let me turn my, so you can see this better. So she makes cool wraps. This one's for your belly, but she has ones for your thyroid, and she has ones for your breast. And then you can also do, old school way, which is just a piece of flannel and an extra piece. The one thing about castor oil is it's messy. I just, before the call, massaged my cuticles and my finger joints with castor oil because I have arthritis in my hands. The castor oil really helps, but now I'm going to be sticky for a while. So I'm sure we're going to share a bunch of these tips, but one thing that I do is I have my castor oil next to my bed with a rag because I can like wipe it. But there's a lot of people who go, don't waste that castor oil. It's so good, because you can also use castor oil on your eyelashes. You can use castor oil on fine lines and wrinkles, on scars. Like we should have this call be, what can you not use castor oil on? It's so, so good. Another thing I do is when my frankincense roller, so my frankincense touch, or my helichrysum, or my rose, or my neroli, any of the wonderful oils that are good for skin and scars, when they're half empty, I fill it up with castor oil. So this can be a nice thing to have by your bed, and you can roll it all around your eyes. It helps to grow eyelashes and eyebrows. It helps with eyesight. It helps to, oh my gosh, over and over again. So I'm going to stop talking about all the things I love about castor oil, because we have some doctors on the call and we want to hear about the why and the science. And then we're going to go into all the little tips and what oils to pair with your castor oil. So Dr. Josie, Dr. Louise, Dr. Mika, who wants to tell us why, like what the heck is castor oil and why is it so magical?
Go for it, Dr. Louise. You are the expert. We're waiting for you.
I'm gonna punt to Louise first.
You are the
She
queen.
is even the balneotherapy expert, which I'm gonna bring that word out.
Throwing around the big word.
Say that
It's a
again.
big word.
What is that?
I know.
You probably know it as spa therapy. So balneo means bathing. And so one of my professional focuses has been on what we call in naturopathic medicine nature cure. So really using the basics of hot and cold water, nutrition, sunlight, air, earth, and really basic practices like castor oil packs have been forming the basis of our professional, many naturopaths and other healers in other traditions across the world have used castor oil forever and ever. And I just want to say right off the bat that I am a huge fan of science, and I really love when science can support traditional use of plant medicine or botanical medicine or nutrition or anything like that. However, we know that it takes a lot of dollars to do real randomized controlled studies for these things, and there's not a lot of financial profit in selling castor oil. And so we do have some research, definitely, but we don't have the massive amounts of research that I believe we could have if we actually did the research. You know what I mean? We have so much traditional use and clinical evidence, and just like I've been using it personally, and I can tell you some case studies and that kind of thing that will really, really blow your mind. So, but we do know a few things. One of the things that I have mistakenly been saying for years is that we know that the ricin bean, or the castor oil bean, has a toxin in the bean called ricin. And we know that castor oil has been used traditionally as a laxative internally for many, many years. Like, take a little bit, we were talking about parasite cleanse earlier. Like, some Caribbean people would give their kids a little bit of castor oil every week just as a preventative for parasites and stuff like that, to keep things moving out. And I was taught, and even just this morning as I was reviewing my research, that the castor oil has a little tiny bit of that cathartic laxative irritant to it, and that's why it's moving your lymph and blood so much when we use it topically. However, upon a little deeper research, I learned that there's absolutely no toxin in the oil. The ricin is only in the bean, not in the oil. So I think everybody will be happy to learn that it's non-toxic. And the mechanism of action of why it's so wonderful as a laxative in the body has more to do with its effect on the smooth muscles of the intestines, and how it stimulates nitric oxide production, which is a gastrotransmitter, and increases contractions of the intestinal walls, and helps with regulating prostaglandins, which are part of the whole inflammatory cascade in our body. So I thought that was really cool. We also know from a scientific perspective that the triglyceride ricinoleic acid, which is in the oil, it's the only oil that has this fatty acid, and it has a very low molecular weight. So what that means is that it really makes it easy for other substances to go with it across your skin and into your body. So it is the ideal carrier oil for us to be using with our essential oils if we want to usher them into our body and let them go through our cells into our lymphatics and our bloodstream. that's a little introduction from the science perspective. I definitely have more from a clinical perspective, but I don't want to dominate the conversation.
Louise,
Yeah.
I remember the one thing we had in school was, like 1 or 2 studies where it was showing increased lines of white blood cells, immune lines and
Yes.
lymphatic. Yeah. So it was kind of a small study, but they're pointing to it. They're saying in this study, people using it, and then they would take the blood and look and see, oh, it's upregulated the immune system via the white blood cells and the lymphatics, right? That was
Yeah.
kind of what I remember.
Yes, definitely. I
Mhm.
did find that too. And I can link to, I found a website that kind of clumps the research together,
Oh, wow.
which is kind of
Nice.
fun. So I'll
Yeah.
post that in the group. But yeah, I mean, it's really affecting so many different systems, and the immune system is being one of them.
Immune system. Let's encapsulate what you just said. When you say prostaglandin, I say pain relief.
Mm-hmm.
Immune system pain relief. When you say smooth muscle,
Inflammation.
I say digestive support.
Well, think of any sort of cramping. So it could be digestive or
Menstrual
hormonal.
support. When you
Mhm.
say low molecular weight, I say driver.
Mhm.
It is one of these things we think about. Peppermint, we say, is a driver. There's a couple of things, but as a carrier oil, being a driver is super juicy. So it's doing so many things all at once.
So just to back up a minute and make sure everybody understands that, I started by talking about taking castor oil internally as a laxative, but
Mhm.
really what we're talking about in this call is using castor oil topically.
Yeah.
And so when we're talking about affecting the hormone regulation and the lymphatic flow and the white blood cells and our immune system and our digestive tract, we're talking about using a castor oil pack that is placed basically from the base of your rib cage to the top of your pubic bone, covering all of your major internal organs, liver, ovarian, blood flow, digestive, all the juicy stuff. So we know we have all those great pockets of immune cells in there, and we're flushing blood and lymph through that area.
Okay, so let's talk about we talk about why we love castor oil application. So Erin came in and she was like, you can use it on your eyebrows, you can use it on your eyelid, face, your thyroid, your knee pain, right? Pain area. And then you're saying as a general therapeutic, we learned the castor oil pack as a cotton wool, piece of fabric folded and you saturate it with the castor oil, and then you put it over the whole abdomen and you put hot on top of it. So let's talk about all that, like all the different ways we can use it, and then we can go into the sort of less traditional ways. And then Sarah Piper just asked a great question. So I just love, I know, Erin, where this is going. It's ping-ponging all around. Like, do we want to, Louise, or Meek, or anyone want to
Yeah.
talk about the traditional naturopathic castor oil pack that was kind of the first one?
Oh, go ahead, Louise. I want to talk about the non-traditional
I know, me
way I
too.
Okay. I
I'm
was
sure
just
Erin.
gonna find my link to my instructions. So what we're calling the naturopathic castor oil pack really came from Edgar Casey, who was a medical intuitive from the early 1900s. And he recommended castor oil for many of his patients, and it became a widely adopted practice among natural healers of the time. And I think it might have depended on what school you went to. I don't know. Is that true? I know we have Dr. Dick Tom at the Natural College of or University of Natural Medicine, who is a big proponent of what he called basic treatment guidelines. So this is like foundational health habits, which is what we're teaching you all. And the concept is, what's the small hinge that swings the big door? Like, we know that if our liver is stagnant and not flowing blood, our digestion's going to be bad, our hormones aren't going to be balanced, we might end up having some emotional dysregulation. So really, everybody's going to benefit from having more liver harmony. Same with our immune system, our nervous system, our inflammatory system, which gets out of whack. And then, of course, our digestion is the root of our health. If we're not absorbing our nutrients or eliminating what needs to be eliminated, there's going to be downstream problems. So these castor oil packs became one of these foundational health habits that have such a broad impact of support on the whole physiology of the human. And so I started out in my practice really recommending them to everybody. And I still believe that they are beneficial for everybody. And I know that our modern lifestyle makes it very challenging for some people to find 30 to 60 minutes to put something really messy on their body, put their legs up the wall and relax. And that doesn't mean that it's not important, but it means that sometimes having a doctor say, you have one more thing that you're supposed to do to take care of yourself, and it just doesn't end up feeling very empowering. So that's something I'd love to bring to the table and hear. How do we find time to support ourselves in these ways that seem, because you're not going to get, honestly, you're not going to get that much benefit from doing a castor oil pack once. It's really with the repeated, ongoing, gentle support of our health that we see benefits from these natural health interventions.
I want to say thanks, Dr. Louise. This is so fun about, isn't it? I don't do it that way, but what's really allowed me to be consistent with my castor oil application is the oils. So Sarah Piper was saying, wouldn't this be great with SOCs? Yes. So you could put that, so there's a couple of things that I do, but you could put the SOCs on the bottom of your feet and then just rub castor oil on your belly. I don't do the hot pack unless I'm like, oh my gosh, I have all this time. But I do like rubbing it on my belly, and then have like a t-shirt that I'll go to sleep in. Or while you were talking, I just rubbed it on my neck and on my lymph because I'm getting over a cold, and then put a couple drops of frankincense on my neck. So whatever I'm going to do that can be consistent is how I'm going to get that castor oil on my body. Mm-hmm. For some reason, the Heritage Store castor oil isn't as, it's great. It's like, I'm absorbing it. It's not as messy, I want to say. It's more smooth.
Not as sticky.
Yeah, not as sticky. I also, we have some recipes that I've made. One is a hormone blend where you actually put the castor oil mixed with the essential oils, and I have it in a bottle next to my bed, so you can do it that way. And then, yeah, again, for me, I'm okay with just rubbing it right on my whole. I start on my torso, but then I go, oh my gosh, I have so much more. I'm just going to do my breasts and my neck while I'm in bed. So what makes me compliant is adding the essential oils of my choice. And another one that I use is Zindocrine with the castor oil on my liver. Zindocrine is all about liver infiltration. Yeah,
What
so
I've
apply it. How
experienced,
about you, Dr. Josie?
I love what I've experienced is if when you mix castor oil with even a little bit of another carrier oil and then the
Mm.
essential oils. So it was so fun this last year at convention. They had a lab where we actually made up a face serum. And it was castor oil, and there was one other carrier oil with it. Was there not, or was it
Yeah.
just
Was
castor
it
oil?
neem oil or
No.
uh,
Does anyone know? Remember? Uh-oh. Um, and a lot of essential oils. And when you do it that way, jojoba, it was a little jojoba and then a bit of castor oil and then the essential oils in it for a face serum. It's not super sticky. It feels fine. Like you're so that is one way to make a beautiful serum, like a hormone balancing formula, a face serum, and working it in, especially as Erin, I'd love Erin to talk about working it. As we know, it really helps with our hair growth for our eyebrows and our eyelashes, and then to optimize with another carrier oil you love on the face. I love the moringa seed oil that we get with the rose promotion at Mother's Day. That's my favorite to add with the castor oil. And then my favorite essential oils that I'm using. But also, as Dr. Mika's saying, if you use some and really work with it and rub it in and using some essential oil with it, it rubs in pretty well on your abdomen, and you have your castor oil t-shirt that you wear to bed. You're pretty good. You're not gonna like stain up the sheets and stuff.
Mhm.
I have not used it with the SOC, so I love that, like actually on the spine. I love that suggestion. One thing you just have to think about is it is going to be a little bit different for the person receiving at the end in terms of the oil. They're going to feel it will be a little sticky, and the oil, it'll have a different sensation. So they just need prepared. They just need to know that. Now, if you have a hot pack, the whole point of the hot pack, you you have this pack of, like Erin said, her friend has these really wonderful belts, or they sell them. The same Heritage people will sell the pack of wool that you buy for the castor oil pack. You kind of lightly saturate it on the first time you use the cloth. And then every time after that, it's about 1 to 2 tablespoons of fresh castor oil. That's it. And then I always add essential oils. Like my go-to, as Dr. Mika said, on the abdomen is Zendocrine. Of course. Of course. Why would you not? With the castor oil. And then you close it up. I keep it in a little plastic bag, and you can then keep it in the fridge. You just have to remember to take it out enough time in advance that it's not too cold. But over time, castor oil is a carrier oil. It will be rancid. So keeping it in the fridge lets you keep that whole pack longer. And then every time you just do 1 to 2 tablespoons of fresh oil, your essential oils, plunk it on the body. The heat on top is again what's helped drive it in more. And when you apply extra heat, it is less sticky. The heat also gets the oil going, gets it absorbing. The more you absorb, the less extra is going to be there on the surface sticky. So those are part of the things. Let's let Erin talk.
Here's
We
some
have,
practical tips. This is the
yeah.
first thing I want to say about this whole sticky castor oil thing is there is an element of becoming friendly with castor oil.
Yeah.
You know, a lot of us love plant spirit medicine, and there is something about castor oil where it's like at first glance, you're like, ooh, it's sticky, it's messy, it's awkward to have this pack. And then like when you push through that and you make friends with it, you realize that it is like yummy and wonderful and like I want castor oil on me everywhere all the time. It's kind of weird, but I promise you. So a few kind of practical tips about this is if you take the bottle, if any of you have that Moringa rose bottle, it is like the perfect size and the perfect pump for having your little castor oil next to your bed. Personally, I love making Dr. Mika's hormone blend in that white bottle, and I have it next to my bed. And I put that in the chat. We'll make a meme or something for it. So one way to do this is you have your little bottle next to your bed. That way it's not too much, because like the big bottle will go rancid, like Dr. Josie was saying. But if you have your little bottle next to your bed that you're filling up about every month, if you're using it every night, and you can choose to have it be plain, no essential oils, or you could make up the hormone blend, or you could make up a symphony of the cells blend. I love where we're going with this, because you could absolutely make up an anti-inflammatory or an antiviral or an antidepressive symphony of the cells in the castor oil in your little pump bottle. Or you can pick and choose the oils that you need to go with. My point is, if you have that bottle next to your bed, just every night before you go to sleep, you can rub it in all the places. So what I will do is I'll put a few pumps in my belly button, because there's something really yummy about castor oil in the belly button. It just feels good. I notice that my digestion is better if I do that almost every night. I notice that I'm not constipated. I notice that my joints don't hurt as much. There's so many benefits that I'll notice anecdotally. Then you can rub leftover into your armpits and your breasts, and that's going to help with lymph flow. And while you're there, do a little personal breast exam. Why not? We should be touching our breast tissue more often than we do. Then I have a little left over, and I'm going to give myself a lymphatic face massage. If you go back, I don't know when we did it, but we had Sandra Freeman talk about, or maybe it was Contessa Beth, talk about lymphatic drain of your face. So there's some really simple movements that if you do this every night with your leftover castor oil, not only will you have like nicer contour, less wrinkles, but when you lymphatic drain before bed, then your brain can actually detoxify, which is a whole nother subject, but can help you avoid cognition issues down the road. We need to be detoxifying our brain at night, and lymphatic drainage is important to that. So I just take the extra castor oil and I do my little face massage. Maybe you have your gua sha by your bed. So the whole point is you're getting into a daily habit routine of using your castor oil, habit stacking with other things like your gua sha or your lymphatic drainage. And then this is when I go, well, yeah, and I want to grow my eyebrows and I want to grow my eyelashes. And you know what? I want to get rid of the wrinkles here. So by that time, you've gotten rid of all the castor oil, and it really does like sink into your body. Kind of extra step that you can do is you can put castor oil all over your face and go to sleep. Pair that with like frankincense or helichrysum, and you're going to have all these anti-aging qualities. So my point is, just embrace the castor oil. It feels messy, but it really isn't. Kind of like Dr. Mika is saying, have an old t-shirt that you wear to bed. Sure, have your packs around if you want to. Have a little rag to wipe it off, but don't waste that castor oil. Like, get it everywhere. There isn't a part of your body that you couldn't benefit from putting castor oil on. So that's my little bit.
Can I jump in here and just answer the unasked question, which is there anybody that shouldn't use castor oil? Because, you know, we're saying it's amazing and everybody wants to try it, and that's true. And also there are a few cases where you might want to be a little more cautious. From what we've talked about, like we know, especially when you pair castor oil with heat, we're increasing the blood flow. So if there's a situation like if somebody's in having their period and they're really having a heavy flow, you might think, oh, it would feel good to put castor oil on, but it might actually increase your blood flow at that point. So it's not a absolute 100% no way, but it's a be very careful in that situation. Definitely, you're going to want to be using your castor oil packs on the other times of the month so you can get your hormones balanced out so that during your flow is not so crazy. Another case that is a case-by-case issue is if you have an active cancer that we're concerned about increasing blood and lymph flow, possibly feeding a tumor. So that's a case-by-case, work with your doctor on that one, because it's not necessarily bad, depending on how and where you use the castor oil, timing and everything. And then with pregnancy is the other one that is a caution as well. And you know, I feel like the body knows what it needs to do when it's pregnant. It doesn't need the castor oil moving everything along. Like, just let the baby be. Can you think of anything I've forgotten, Josie or Mika or Erin?
Yeah, just the
No.
pregnancy thing is pretty important.
Yeah. I want to address, Rebecca had a question about, would this be helpful for vaginal dryness? And I would say yes. And I would say pair that castor oil with my hormone blend. That's what I do for vaginal dryness. It's a great combination. Or let's say you don't want to make the hormone blend, castor oil with the yarrow palm serum is also really good for vaginal dryness. So those are my 2 tips.
Oh, you just reminded me, Dr. Mika, that one way I used castor oil is to help with scar tissue in my perineum. So after giving birth, I tore in my perineum and it created like a lot of scar tissue there. So I can massage it with the castor oil, but you could also add something like a little helichrysum or a little myrrh, the immortelle, anywhere that you have scar tissue that you want to break down. So would this, doctors, this is a question for you. Would this be good for like ovarian cysts, PCOS, things happening in the uterus, the cervix? What about like vaginal suppositories with castor oil? Would we do castor oil packs for those things? Would it be appropriate to do your frankincense and castor oil in a vaginal suppository for healthy cervical cells?
I would say yes. I don't know. I haven't thought about, I've used with patients suppositories, but I never thought to put in castor oil.
I
don't
know,
how
and
that
we
would
weren't
harden. We use
heard of that.
um
Interesting.
cocoa
Butter.
cocoa butter to harden the suppository. So I just don't know how that would harden.
Oh,
But
well, so I've done vaginal suppositories and I use a little tiny syringe and then
of
I put my
castor
legs
oil?
up the wall. I have not done castor oil. That's why I'm asking. I've done coconut oil or olive oil with like frankincense, helichrysum for cervical cell health, and then feed up the wall and then it drips down into the cervix. But our conversation is making me wonder if castor.
Oh, I think that's like the most ultimate idea would be the castor oil with
Yes.
frankincense, or my cellular protection blend that I made up, which is for cellular health. Yeah, great idea.
We always end up talking about vaginal suppository when I'm on the
Yeah.
call. Sorry, everybody.
You know, makes me think for any kind of healing of any yeast or bacteria situation in the vajayjay, we do the little OB, get the littlest kind, the regular, and because it doesn't need to be super big, and make up a oil blend with, I would usually say coconut oil, right? Same thing, like, oh, I'd usually say coconut oil, but what about saturating the tampon with castor oil with then 4 oils I recommend are that feel fine inside the vagina are frankincense, lavender, geranium, and tea tree. Our tea tree, no one else's.
Very important. Only doTERRA tea tree.
Yeah. And that's an amazing combo there to then, I think it's like all these formulas to think about an upgrade and then saturating that tampon. And then you wear it for, half of the day, 8 to 10 hours of a day, whether you want it at night or in the daytime, you can choose, for, anywhere between 7 to 14 days. New tampon each time.
Yes, and so we could do oils for vaginal dryness. We could do oils for increased blood flow. So many options.
Did you list that? That was really wonderful. Again, Dr. Josie, the list of oils for JJ likes.
Yes, right. That are very immune boosting, antimicrobial,
Good.
yet, nice, soft and not irritating. Frankincense, lavender, geranium, and melaleuca tea tree.
I want to add to that list, like yarrow palm. It's such
Yeah.
and
Like I made that was
copaiba.
before yarrow palm. Like, but
Copaiba.
sure, that's kind of your base.
Yeah.
Okay.
And then you can add newer right, copaiba and yarrow palm would be really great to add in there.
So copaiba, yarrow palm, frankincense, lavender, geranium, melaleuca, tea tree. Okay. Castor oil.
Yeah.
And you soak a tampon and wear it for
like you would make up a bottle. And then you don't need a lot. You just, pouring it over like maybe in a little the tampon and rolling it around so it's kind of soaked.
Soaked, yeah.
Yeah.
Cool. Awesome. Okay, thank you.
I just want to throw out here that these are really beautiful remedies that we have at our fingertips to use when we have an imbalance that comes up. And just a reminder that our vaginal territory is a rich microbial ecosystem of, that has a balance. And so we don't want to be using a lot of things that are going to be affecting the microbial balance on an ongoing basis, because then we'll just end up with another problem.
Yeah.
So
right. That recipe is for if you already have an imbalance and you correct it.
So if I wanted to experiment with vaginal dryness, I might just do like
lavender,
lavender.
Yeah.
Lavender, right. Okay.
Yeah. Frankincense.
Thank you.
Or just the castor oil.
Just the castor oil.
Or just the castor oil.
I would say, I would say it would be castor oil and yarrow palm or yarrow palm serum.
Okay. Great.
Yeah. I think that would be the least disruptive.
Great. Good. Yeah. Thank you.
So I have two things I want to talk about. I love to maximize habit stack. What do I call it, doctor? I call it the, twofers. And in that vein of making things compliant and doable in our own way. So some of us got really excited about hydrotherapy. And so after this, I want to talk about warming socks and wet t-shirt with Dr. Rose and how juicy that is as a complementary therapy. And so some of us have access to saunas a lot. And if you do, or even at a gym, right? Sauna is a built-in hot pack. And it's a perfect place to apply not only Symphony of the Cells, but also castor oil and have the heat of the sauna help you absorb these things just all the more, like more better. And so what I have, and I've done, and I know Dr. Mika, Louise has this, I have a sauna and I have a couple little cute, I could go down and get them if you want, bags that contain, it's a row of 8x4 oils for essential oils. And I have 2 of them filled with the 8x4 of my oils. And those are symphonies or different arrangements of a symphony is just an arrangement of oils that different people have come up with that we know have some really great sequencing benefit. And I bring them into the sauna. And on my first round, because I always say do 2 or 3 rounds, and then you do cold in between, whether it's a cold plunge or a cold shower or just sitting out in the cold.
Wow.
That is the best way to work with the heat of the sauna, is not just heat. You want to alternate the heat and the cold, and you always want to end with cold. And when you first go into the sauna in your first round, the easiest thing to do, well, I don't bring that big bottle from the big pink bottle. I have that. I have a little thicker roller bottle. So you want something that's smaller that you can kind of bring with you. And I squirt it into the palm of my hand, and then I apply it. My knee is my area of concern right now. I apply it onto my knee, and then I put it onto my belly. First the castor oil, and then I have my cute bag of my essential oils, and I just start going. And I go with any sequence of oils I want to be working with, anywhere from, I would say, like 3 to 4 to 9 is the most in some of them. And I just do the bottoms of my feet. I start with the first oil, bottom of the foot, and then I go to my knee, my area of concern. If you have a sequence of oils that has some hot oils, what are the hot oils? Cinnamon, thyme, oregano, cassia, ginger. Those are usually the oils, or any of the peppermints, any of the mint oils. They're not hot, but when you do them in the sauna, they get too intense. So I don't do any mints, and I don't do any of those hot oils in my sauna. You can do them on the bottom of your feet. That's the one area you can do them. And then I just sequence back and forth between the whole thing, applying the castor oil and the essential oils takes no more than 10 minutes of that first round in the sauna. And I'm just doing it and I'm applying it. I put it on my areas and then I go. It's such an easy way. If you have access to this, it's fun. It gets like it amplifies all the sauna aspect. It amplifies the essential oil aspect. It amplifies the castor oil. It's just great. So that was my one big kind of thing. And then I'd love for Louise, you want to talk about, and we have a great case study of a friend who just got through this cold flu thing that's going around that's really mean and is like 2 weeks of taking you down. And the thing that just helped her the most was warming socks and then warming or wet t-shirt. And you're asking probably, what the heck is that? So I love to go over that as well in foundational wellness.
Beautiful. How inspiring. And for those of you who don't have a sauna, sometimes having a nice hot bath is a beautiful way to also receive. Of course, you can't layer the oils, but if you want to put your castor oil on before you get in the bathtub, it's thick enough that it doesn't wash away right away, and the heat of the bath can help it absorb, and then you can use soap and wash it off and get out. And that's another very habit stacking way to do your castor oil packs. So warming t-shirts and warming socks treatment are both hydrotherapy treatments, again, from this like nature cure tradition in naturopathic medicine that really looks at the repeatable, predictable physiological response of the body to hot and cold. So we know that when we are in cold, our blood vessels constrict to send the blood back to our vital organs, where it's most important that we have our blood flow. And then when we are heated up, like in a sauna or hot tub or bath, our blood vessels dilate towards the periphery to allow us to, not overheat too much. So we have this like back and forth with the constriction and dilation of our blood vessels. So what happens, I'll tell you about warming socks first, and then tell you about the warming t-shirt after that. So with the warming socks treatment, you're going to be thinking about it anytime you're starting to get sick, anytime you feel like you have congestion in your head or sinuses or or chest. Anytime you're having trouble sleeping, anytime you're feeling like your energy is like just swirling around in your head and you need to come down into your body. Anytime there's like circulation problems, I have some patients who say that they really can't fall asleep because their feet are cold. So we do this and it really changes their nervous system response and allows their body to come into relaxation. So before your bed, you're going to either take a hot bath or shower, or at least get your feet hot. So I often will just sit on the side of the bathtub, run the bath with some hot water, soak my feet so they're getting nice and hot. While that's happening, in my sink, I have a pair of thin cotton socks that are soaking in cold water. And then next to me, I have a dry pair of wool socks and whatever oils I'm going to use. So after about 5 or 10 minutes in the heat, I take my feet out of the hot water, dry them off on the towel, put whatever oils I want on there, wring out my wet socks, the cold wet socks, so that they're not dripping. You wring them out as much as you can. Put them right on your warm feet, and dry wool socks go over top. Make sure that there's no wet socks poking out. You want the dry wool socks surrounding everything. And then you go get in bed and snuggle up under a blanket and conk out and have a really great night's sleep. And what's happening while you're resting is that you're not feeling like your feet are cold. Let me just reassure you that like that sensation of putting cold, wet socks on lasts just seconds, and your feet are so warm that it doesn't really feel uncomfortable. And so your body is registering the fact that there's cold, wet socks on your feet, and your body is sending blood down to your feet to try to dry those socks out. So you have this big pumping action in your whole system of circulating blood and lymph. And every time we do that, our immune cells get circulated, and everything gets kind of like elimination gets upregulated. Everything just gets a boost. And so we wake up in the morning after having a great night's sleep. Our immune system has been regulated, and the congestion has usually drained from the head. So when you would want to do a warming t-shirt treatment is when you're in a situation where you have a bunch of congestion in your chest. And it's basically just like warming socks, only you are going to take a hot shower or bath to make sure your torso is completely warm. You have a t-shirt in the cold water and a wool sweater to put on afterwards. And you're basically going to be pumping blood and lymph all through your lung cavity and your heart and all these immune cells in here while you sleep and rest. Oftentimes, when we're sick with a respiratory infection, the coughing will keep us awake at night. And when we can't sleep, then of course it takes us longer to heal. So this is going to help calm down the cough, really move that mucus and stagnation and junk out from all those interstitial cells around your lungs. And then of course you can use whatever oils as well to promote your immune health or respiratory health with that. So yeah, our friend had been sick for about 10 days already when she contacted me and was like, I don't know if I need to go to the doctor or have somebody listen to my lungs. It feels like it's going on. I can't sleep. I'm coughing a lot. When do I, how do I know when how bad is it? And I said, well, try this tonight and then tell me in the morning how you're doing. And so it was a turning point. She tried the warming t-shirt that night and she was able to sleep through the night. And every night after that was moving in the right direction. So it's a very, very powerful tool to have in your back pocket.
I love that. I definitely can testify on the magic warming socks. They knock stuff out. I always tell people to do it. I do it on my kids. And it feels good. It really doesn't feel yucky. It feels really good. And I will usually do Purify and oregano on the bottom of my feet before I do the magic socks. If I'm fighting something. Aisha, I think you had a story to share. Sorry, Louise.
Oh, that's okay. I was just going to say, sometimes when you're already sick, it's hard to have the energy to like find the wool socks or whatever. So I recommend just like getting your little warming sock kit and then just having it ready for you for when you need it.
That's a good idea.
Before Aisha, I just want to say I just posted in the chat again, it's up at the top, but Dr. Rose on her website, she has under patient forms, she has 2 incredible full documents, links with full explanations of how in detail to do the castor oil pack and the warming socks or t-shirt treatments. So that's where you can really, if you have never done them before, get kind of full explanations.
Thank you. I love the reminder of these daily habits. Castor oil is something that I use on a religious basis, but I have to admit I've kind of gotten away from it, and I'm definitely going to bring it back in. And I do want to share a personal experience that happened that was quite powerful with castor oil. This was years ago. I had surgery and I had a cyst removed off of my right ovary, and another cyst began to grow, and that surgery was horrible and something that I never wanted to do again. And so and my doctor, we were monitoring it with ultrasound, and she basically was like, if it gets much bigger, we're going to have to do this again and go in and remove it. And I said, well, that's not going to happen. I was religious every single night for probably several months with the castor oil packs. I used geranium and cypress. And then sometimes I would alternate Zendocrine in there. Now, I also want to add that I was doing the doTERRA supplementation as well, and the phytoestrogen. So I was bringing all of the things in and the DDR prime, but I really felt like it was the castor oil that cyst shrunk, and I never had to have that second surgery. I know that our dear friend Ellen had a very similar experience. So I know we are kind of our own testimonials, and it wasn't just me that this happened on. So if you have any endometriosis, um, uterine pain, cysts going on, probably fibroids, the castor oil and the oils is magic and so, so supportive.
So Aisha,
Oh, go ahead.
Yes, and Erin mentioned PCOS as well. Let's just go between all of us so you did geranium and cypress. So I know that geranium is in Zendocrine, and I know that cypress is an aroma touch blend. Those are 2 really great because they're blends and they kind of can draw on things. So you could go with the single oils, you could go with the blends. Any other, what comes to mind out of for
I also want to
everyone
add real
else?
quick too, I was doing Claricalm daily as well. So
Yeah,
that was like
you're
a
applying
daily source.
Claricalm topically to the area, and you were taking the phytoestrogen complex, the LLV and DDR.
Yes,
Okay.
yeah,
Yep.
along with the lifelong supplement, daily
Yeah,
supplement.
the LLV. Yeah.
But bringing
Okay.
in those extra
Any
supplementation.
other ideas? Mika, you would just maybe do your hormone formula?
Yeah, and if people
Ideas?
didn't do the hormone formula, that I would say Clary Calm
Okay, so Claricalm
and
alternating then with
DDR.
Zendocrine. Yeah.
I think what's great is that, this was really early on in the doTERRA days. So we didn't have SOC yet. We didn't have the hormone formula yet. We didn't even have the knowledge that we all have now. So it's wonderful now, many, many years later, that we can bring in these other formulas and information.
I just want to emphasize the lifelong vitality pack, or now we could do the VMG plus, but I know I've had multiple experiences. I know we could do so many stories about passing lots of blobs from our bodies. Josie has one of her friends who's on LLV and then passed a blob. I've passed multiple blobs post
Yes.
pregnancy with the LLV and the oils on my uterus. So all of that together is very powerful medicine.
Yeah, I'd like to second that. When we say foundational wellness, we have these amazing nature cure hydrotherapy techniques that we're kind of amplifying with the use of the essential oils together with them. This is all topically. But if your system has gene snips, if it has gotten out of order, if your food is not which tip top, which we could make the argument it's hard to do in today's environment, having enough of the cofactors of vitamins, minerals, greens, the things to allow your body to begin to do the sweeping up and all of the detoxifying and helping to heal with all of this incredible plant medicine and hydrotherapy and these techniques that we're giving it, you also need this other foundational medicine. And that's how they go together like that for then your body to powerfully get itself out of the pickle it's gotten itself into.
Yeah, Dr. Josie, Ellen's not here, but we've shared Ellen's story, and you can go watch Ellen's story on our YouTube channel. And just one thing that she also did, besides a lot of the stuff we're talking about, is she cut out sugar and alcohol and dairy and gluten. And she is pretty
Yes.
strict on it, even 5-6 years later. So just looking at what you're eating. And one thing that I like to do, because it can be hard to deprive yourself of food, instead think about crowding it out. So taking that LLV, eating more fruits and vegetables, getting more protein, getting more water, can be a more effective mindset than trying to say, like, I can't eat anything. Because we all know what it feels like to go to the grocery store in a I can't attitude. Next time you go to the grocery store, get excited. Be like, what can I cook with lots of vegetables? How can I add more protein into my body? And this is all a process. When I first started on my healing journey, it was a couple of years of detoxifying and shedding and changing habits and working through the whole process. And so we're here for you. That's a part of what this community is for, is to have the support and the guidance and to just be gentle on yourself. But it is important to start to feed your body the things that it needs to be healthy. And we have a lot of great tools with doTERRA. And just remember that sugar, alcohol, white flour, those are some of the inflammatory foods that we want to try and avoid. I know it's at 11, Aisha, so I probably have to give it over to you. But let's thank our doctors for sharing all their wisdom with us. Thank you, Dr. Louise, Dr. Mika, Dr. Josie. Amazing information today.
Yes, I love this. I love this new format. So again, every first Monday of the month, this will be our new format. It will be the Daily Habits Call. We'll have different topics, different people coming and sharing all of their pro tips. So much wisdom, so much gratitude to all of you. Next Monday, we will be tuning in with our oils A to Z panel, and we're doing a deep dive into Aroma Touch, which feels like it just fits right along with today's topic. Have a wonderful week, everyone, and we'll look forward to seeing you next week. Bye-bye.